We're here with Amanda Laskoskie, president of the Pennsylvania Coalition of Nurse Practitioners. Can you explain what a nurse practitioner is for anyone who may be unfamiliar?
So a nurse practitioner is an expertly trained nurse who has gone on to do extensive training post their regular nursing degree. So a traditional nursing student these days starts as a RN-BSN, which is a Bachelor's of Science in Nursing. And then after that training would go for another 3 years as a master prepared nurse that has done focused training in certain areas of treatment. So we have several different areas that people can certify in. So for example, I am a family nurse practitioner, which means that I can treat a patient starting at birth through the entire lifespan. But then we have different focuses. So we have a mental health nurse practitioner, we have a women's health nurse practitioner, we have a strictly pediatric nurse practitioner, and then we have adult gerontology nurse practitioners. There are others that I am sure I am leaving out, but that gives you an idea that there are different focuses that we can do. And we are trained to work in primary care settings to care for patients with, the basic run-of-the-mill illnesses and treat.
Does the work of nurse practitioners differ from state to state?
We are, depending on which state you work in, depends on how far you can practice to the extent of your training. So currently in Pennsylvania, nurse practitioners are restricted that they must work with a collaborative agreement, meaning that they are working with two physicians that have signed on agreeing to be a resource for that nurse practitioner. This makes it sound like we are working side by side every single day. That in actuality is not what happens. Nurse practitioners work independently to treat and diagnose patients on a day-to-day basis. The collaborative agreement is simply a piece of paper that is filed with the Board of Nursing. In some cases, that can be a financial agreement with the physician as well, that the nurse practitioner would pay a monthly fee to that individual to sign the piece of paper.
In his 2025 budget address, Governor Josh Shapiro mentioned wanting to grant full practice authority to nurse practitioners in Pennsylvania. What would this mean?
This would mean that nurse practitioners could practice to the full extent of their training and licensure within the state of Pennsylvania without that collaborative agreement. So currently 27 states, the District of Columbia, and the Veterans Association have all granted full practice authority to nurse practitioners, meaning that they practice independently, they bill, they do everything on their own. They carry their own malpractice insurance. But currently in Pennsylvania, without that collaborative agreement, a nurse practitioner cannot function. And so what happens is Pennsylvania is in the throes of a healthcare crisis. And what we're finding is that as primary care physicians retire, the need for that collaborative physician is increased, right? So as they retire, that nurse practitioner is left without a collaborative agreement. That means they cannot practice within the Commonwealth, leaving their patients struggling to find care. So currently, even with a collaborative agreement, for example, in my practice, a new patient cannot be seen for 3 to 6 months right now because we are so backlogged with patients. As those collaborative agreements fall off and the nurse practitioner is left unable to practice because they don't have a collaborating physician filed with the state, those patients are left in jeopardy, right? They're just out there hanging. It's not like they can just go next door to the next provider and say, I need to be seen, and they're seen right away. So these patients are left floundering for care. And so what we're asking is that we be able to practice to the full scope of our training. It does not change what we're doing. It's doing the same thing that we're doing now, but it grants those patients the freedom to be seen.
You mentioned Pennsylvania being in the middle of a healthcare crisis. Can you talk about that a little bit more? Why is that happening? How can it be fixed?
So we have so many individuals within the Commonwealth that need care. There simply are not enough providers to care for these patients. And so it becomes even more dire. In 2026, it's estimated that 30% of primary care physicians in Pennsylvania will retire. And so that lessens the availability of collaborating physicians. It lessens the availability of providers overall to care for these patients. And what we have found is that nurse practitioners are within the state. They are here. They're willing to practice. They want to see these patients, but we need to be able to. We are just one solution, right? So we need to look at how do we get more providers to stay within the Commonwealth? How are we more attractive to the Commonwealth? We have huge healthcare deserts. Particularly some of the rural areas are particularly bad. Blair County, we have hospitals closing where patients are driving an hour and a half to deliver a baby. Can you imagine being pregnant and in labor and knowing that you've got to make it an hour and a half? I mean, we're having babies delivered on the side of the road. This is terrifying for anybody in that situation. And with hospitals closing left and right, Chester Crozier right now in a very densely populated area is closing as of May 2nd and taking Springfield Hospital with them. So that's Delaware County and Chester counties that are being affected. The hospitals in those areas are already so overpopulated and struggling to care for the patients they have. To absorb a large health system trauma center closing down is going to create more havoc as well. And it's terrifying to think that, to have to travel an extra 10 minutes as a trauma patient or a critical heart attack patient, that is life or death. And we are losing these health systems.
What impact would having full practice authority for nurse practitioners in Pennsylvania have on Pennsylvania's entire medical industry as a whole?
So it creates a free market, so to say. So it makes us more appealing to those individuals who want to open up their own practices. Right now, Pennsylvania is an island. So we have New York, New Jersey is on the cusp, but New York is full practice authority, Delaware is full practice authority, Maryland is full practice authority. So individuals within the state can travel just a short distance and practice without restriction, whereas they still live in Pennsylvania. So we're losing precious healthcare capital to these surrounding areas, which if we have full practice authority, these nurse practitioners might be more willing to open up an independent practice within the Commonwealth and provide care to our own patients.
You mentioned multiple other states that have full practice authority. Have they seen like an impact and an improvement on their patient outcome?
So yes, we actually have many studies that prove that those states that have gone to full practice authority actually have improved health outcomes for their patients. In certain situations, things like diabetic ulcers, we have found that those under the care of a nurse practitioner have done remarkably well. Does that mean that negates the need for a physician? Absolutely not. There is a role for everybody in this, and there are things that I cannot do that a physician does. And we are not trying to replace a physician. We are simply trying to fill a gap.
The website careforpa.com mentions that full practice authority would save the Commonwealth money. Can you explain the correlation between the two?
So there is, first of all, nurse practitioners bill at a lower level than a physician does. So we are reimbursed at 80% currently, as opposed to a physician who is reimbursed at 100% for their care. But additionally, it saves in some ways. So physicians are being paid a collaborating fee that the healthcare groups are paying. So like a health system would pay the physician to collaborate with the nurse practitioner within that. It also is a money-making thing for the state as well, or the Commonwealth, because you are paying to be licensed, correct? So that there's that piece as well.
Spotlight PA published a quote from the president of the Pennsylvania Medical Society, who said that, quote, "The people who have the most training and the people who have the most expertise are the ones who should be leading that team," end quote. What is your response to this?
The response from the organized medical societies have always said that they feel very strongly that it should be a physician-led project of care. The fact is that right now we are struggling. The crisis in Pennsylvania has only gotten worse, and it needs to be addressed. And nobody is saying that the physician is removed from care. It's just saying that a nurse practitioner can step in and provide care safely and phenomenally, quite honestly, to these patients. They are not going to replace the specialist. They're not even going to replace, it's not that the primary care physician will be eradicated, that role is eradicated. There's a role for everybody.
Senators Camera Bartolotta and Lisa Boscola sponsored a bill to give nurse practitioners full practice authority after completing certain requirements. Do you think that is fair?
Yes. So we were part of having that bill organized. So we agreed that a new nurse practitioner coming out would benefit from having a collaborating, an identified physician to collaborate with if questions were to come up. And that nurse practitioner would need to complete 3 years and 3,600 hours of practice prior to coming out and practicing independently.
Your website mentions that current restrictions on nurse practitioners are, quote, outdated. Why were these restrictions put in place originally?
Because of antiquated views that nurse practitioners worked under physicians, quite honestly. And the role of the nurse practitioner has evolved since the 1960s when it was first developed. Initially, it was developed to go out into rural areas and treat pediatric patients who were very sorely in need of care. And then it expanded to treat everybody across the lifespan. And then as that role became successful, they looked to do more specialty care like mental health and a maternal health care. These are important areas that need to be addressed. We have patients waiting 6 months to a year to be seen by a psychiatrist, and a mental health nurse practitioner can be seeing that patient initially, and then when it becomes out of her scope of practice, his or her scope of practice, can refer to further up the specialty, but at least can get the care started with somebody who has done that focused training and is able to treat and diagnose and recognize issues and get these patients in rather than them floundering and winding up in ERs and mental health hospitals.
Have you heard from physicians about this bill? What have they said about it?
So, most physicians in the setting outside of Harrisburg are, kind of indifferent or in support of it. I've had some physicians say that they don't see any difference in between what I do in primary care setting as to what they do in the primary care setting. Then, of course, there are those physicians who, along with organized med, feel very strongly that this should be a physician-led team. They recognize the role of the nurse practitioner. I think some of this is a fear that if the collaborating agreement is removed, that somehow the nurse's scope would change, the nurse practitioner's scope would change. But the fact is that there are national guidelines as to what the nurse practitioner is trained to do and what they are able to do, as well as the state boards of nursing have very clear scopes that outline what a nurse practitioner is able to do, what would be outside of that scope of practice. And that would, leave that nurse practitioner liable to lose licensing.
Besides the bill from the two senators, is there any other legislation on this topic in front of the state government now?
Yes, so House Bill 739 has been introduced. That's being sponsored by Representative Nancy Genst and Representative Ryan Warner. So again, a bipartisan bill that would address full practice authority across the Commonwealth.
Let's talk a bit about your organization. What work do you do?
So the Pennsylvania Coalition of Nurse Practitioners represents the 20,000 plus nurse practitioners within the Commonwealth. We provide different things. So we provide guidance to nurse practitioners as far as questions about training. We lobby for things that we feel are important. So things like full practice authority, healthcare that could affect our patients. It just depends on what comes up in front of us, but we lend a voice for the nurse practitioners of the Commonwealth to address issues as they come up. As well as provide resources for nurse practitioners.
How long have you been lobbying on the specific full practice authority issue, and has it changed over time? Have you seen any changes?
This started in the initial idea for full practice authority in Pennsylvania in the legislature started about 13 years ago. So we have been working on this for a very long time. Initially, it was full practice authority immediately coming out of graduation from the program, so that there would be no 3 years, 3,600 hours. And really, there was no movement there at all. And so an agreement was made between Organized Med and the Hospital Association of Pennsylvania, where that 3 year, 3,600 hour restriction would come in. And since then, there have been many discussions. In 2019, a discussion was brought up and put into legislation that involved a pilot where a nurse practitioner practicing in a rural area could practice without restriction. And it was identified that they would look at certain markers to see how beneficial it was to the patients. Unfortunately, the Leonard Davis Institute then did a study to see how effective that pilot would be. And it was found that it would only affect 50 nurse practitioners, so a very small portion of nurse practitioners within the Commonwealth. A very small number of patients would be affected. And it wasn't clearly identified what markers would be measured, who would be measuring them, and what the outcomes would be. And so what happened was in 2019, that came up for a vote. It was passed in the House and sent to the Senate within the state, but then the legislative session ended. And at the start of the next legislative session, the pilot was removed from the bill and introduced. And that was based on the findings of the Leonard Davis Institute, that it would not have been an effective study.
What is some other legislation that you would like to see benefiting nurse practitioners or other medical staff in front of the state House and Senate?
So we have a bill currently that would bring recognition to advanced practice nurse practitioners, recognizing the APRNs, so that there would be a specified title for these individuals. So that would include certified registered nurse anesthetists, certified nurse midwives, and nurse practitioners as well, to recognize that extensive training and to recognize that there is a difference between a registered nurse, a licensed practical nurse, and then that APRN. But additionally, we are looking at bills that address things like training within the schools for seizure medications, training in the schools for AEDs, things that would require safety pieces in place at, say, sports arenas, making sure that there are AEDs there. We're looking at bills that would affect the health of the Commonwealth.
Amanda Laskoskie, President of the Pennsylvania Coalition of Nurse Practitioners, thank you for joining us.
Thank you very much.